I think I did.
Where?
Yeah, you'll see on the bottom, it's just recording.
If it is Apple or
Yeah, yeah,
iOS,
Ragad, are you using which device?
Laptop.
I can see you. I can't see that I will allow you. I don't know why. Something is wrong with your device. Others I can. So you're
Okay.
unlucky.
No worries.
Yeah, yeah. Generally it allows, but few devices they don't. Maybe. Okay, guys. So we'll start in few minutes. Are you ready with the printout, right?
Yes.
yeah.
Yeah, and the bill, I think there was some issue. So at the fifth minute, SSL will say 5 minutes, okay? So that what, in case you can't hear, they will tell 5 minutes. You don't have to respond, just hear them, okay? And number six today, in the sense, the room number six, you'll be doing an non-interactive. So let me tell your case number one. Muhammad, you are doing case number one, so keep the reference ready. Ragad, you are doing case number two. Maram, you are doing case number three. Sylvia, you are doing case number four. Balsam, you are doing number six. And Tia, you are doing six. That is number six, non-interactive. Room number
Sorry, Elia, which one?
non-interactive.
Elia will start non-interactive.
Non-interactive, yes. I'll be there when I move it to you. Balsam, you are number five.
Me number 5.
Others, you keep it away, okay? So one will go to two, two will go to three, three will go to four, four will go to five, five will go to non-interactive, and six will go to number one. So in this sequence, keep the reference ready with a big marker. So procedure remain the same. The bail, when you enter, there will be a door note. 30 seconds, you can write down your acronym, and then the actor will be on the camera. So you can start your introduction. My name is so-and-so. And then there'll be a bell, which that means it is started. And then 5-minute bell, which I'm going to do it again, but they will say definitely. This is when the case starts. This is 5 minute. School bell is 7 minute. Then the assessment will start, and 2 minutes and 30 seconds. Okay. So this will be the run. Today we are trying to send the assessment right away in few minutes. So don't look at the assessment. Just verbally you have been told, but look at the end of the session so that you are not diverted. And whatever assessment happened before, make sure you don't remember. You need to relearn. Otherwise, you'll be focusing there, and either you'll be very happy if you did it well. If you didn't do well, you'll be very not satisfactory, so you won't feel good. Gone is gone. So that's what we need to learn here, guys. Okay. So that is pretty much about. See, let me see my SSRs are ready, and then we'll start. Okay.
Ya Allah.
Good luck, guys. I'm assigning your room. You accept and go to that room.
Hello, my name is Dr. Morris. I'm here to discuss with you how we're gonna be going down with the therapy for the antibiotic for our patient Susan Ford.
Hi, doctor. I'm the pharmacist on duty.
Mhm.
So how can I help you?
Yeah, I just want to go to see the next step, like how to step down to oral antibiotic for our patient Susan Ford.
Okay, doctor. I just need to confirm some information first. Is that okay?
Yeah, for sure.
So we have the patient Susan Ford, 56, female.
Mhm.
Her creatinine clearance is normal. Her blood
Mhm.
pressure is somewhat okay. Everything is fine. I see here that she has sulfa and cipro allergy.
Okay.
Severe, so they're true.
Yes.
Okay. And she doesn't have any medical conditions other than the current pyelonephritis.
No, she was admitted yesterday for severe pyelonephritis
Okay.
with high temperature, fever, and then sepsis and vomiting.
Okay. And is she using any prescription medications or non-prescriptions?
No, nothing outside the current order from the hospital.
Okay. And anything significant about her lifestyle?
No,
Okay. And her kidney is fine. What about her liver function?
it's normal.
Okay. And was a blood culture done?
Yes.
Okay. So here we have the sensitivity reports. Okay. And was there any blood work done? Was there anything significant?
I'm sorry, say again?
I said if there was anything significant in the blood work other than
No,
I see
no.
her white blood count is high.
Just she's improving. So her sepsis, everything she's responding really well to the empiric treatment. So that's why we wanna
Step down
Yes.
to oral. Okay. And I see that she's been given gentamicin. She took 2 doses.
Correct.
180 today. Started at 7 yesterday. Okay. And okay. Doctor, please excuse me while I check my reference
Yeah,
for the options,
sure.
and I'll get back to you.
Mhm.
Can I please see the sensitivity report once again?
Yes.
Okay, doctor, thank you for waiting. So the options for severe pyelonephritis for stepping down, it's not an option. It has to be treated with IV.
Oh, but it's not severe anymore. She's stable. She's not vomiting. She responded well to the treatment, so I would consider it mild to moderate.
Okay, okay, doctor. So in that case, we have a first line option of fluoroquinolone, but since she's allergic to Cipro, we can't use that because there's going to be cross allergy with other fluoroquinolones. The other second line options would be amoxicillin claviolinate, sulfamethoxazole trimethoprim, and that's also not an option because of the sulfa allergy, or trimethoprim on its own. So either the amoxiclav or the trimethoprim.
Whatever you recommend.
Okay, so I would recommend.
Just select one.
Okay, and just give me a minute. I'll get you the dose for that, doctor.
Mhm. 2 more minutes.
Okay, doctor. So the amoxiclav would be either 500 milligrams 3 times daily, or the 875 twice daily for 10 to 14 days.
I want 14 days total, and then if we go do BID instead.
Okay, so we'll go with the 875 BID, and you want a total of 14 days?
Yes.
Okay, so she's already taken hospital antibiotics for 2 days, so we can subtract that from the 14 days, and it would be 12 days total.
All right. Yeah.
Okay, anything else I can help you with, doctor?
No.
Okay, thank you, doctor, for having me be part of the patient circle of care, and have a good day.
Thank you very much. You too.
Thank you.
Bye. We still have a minute. Anyways, Maram, the thing is, when the doctor said it's diagnosed with severe pyelonephritis, admitted to the hospital, high fever, vomiting, you know,
Mhm.
and sepsis. And you can see here in the blood work that she's stabilizing, and the doctor mentioned that she's getting better and we're stepping down to oral. So you need to confirm this information. So, doctor, is she doing better now? Is she still vomiting? Because if she
Okay, hold on, your sound is breaking.
so, sorry.
I can't hear you, it was breaking.
Oh yeah. So I'm saying that because of that, you need to confirm this information. So it
Okay.
shows patient care when you ask about the patient, how is she doing? I see from the blood work, because sepsis means she had a very low blood pressure, probably heart rate was higher. All her labs were maybe worse than this. Now she's getting much better. So I don't know why you checked this option, fluoroquinolone. It's for severe,
Mhm.
right?
Yes.
Because he said, I'm treating it now mild to moderate. You don't look at this anymore. Severe was the empiric treatment. She responded. Now
Mhm.
she's stable. No more vomiting. As you can see here, the F, it says high fever, sepsis, vomiting.
Yeah.
So all these resolved. No fever, no vomiting. She's no longer in sepsis. So we're going down to one of these 3 options. You selected amoxiclav. That was the only mistake, because now you have the patient at risk because she's resistant to penicillin.
Oh.
Yeah. So your thought process was right, but you should have said she's resistant to penicillin. So let's go with trimethoprim. That's the only option she can take. Okay.
Okay.
And you realize that it's 12. If you see the answers here, always ask antibiotics used in the last 3 months, any infectious case. You ask about liver, kidney, confirmed all the information. You confirmed true allergy. You realize she had 2 doses of empiric treatment. You check the reference. You said that for severe it should be IV. I reconfirmed that's okay, even if you didn't ask, but I reconfirmed. I said, well, I'm treating it now mild to moderate
Mild to moderate.
because that's why I'm stepping down, or else they won't step down. They will keep the IV ongoing.
Yes.
So realize only option is trimethoprim. Find out dose from drug, from table. It's 100 milligrams VO BID. Realize today's dose already administered, which you did. So you got those 2 points as well. So in terms of points, you gathered many points. But because you're putting patient at risk, antibiotic resistance and no response. So now the patient want response probably to your recommendation.
Yes.
So I don't know how they're gonna treat this in OSCE. I would, like, if I'm an assessor, I would put it as unsolved. Okay.
Okay.
But in terms of point, you will see the assessment sheet. So you as always you perform well, but mind you those small details. Okay.
Okay. Thank you.
No problem. Good luck. The next case you're gonna solve it with me today, I'm sure.
Okay.
Focus.
Yes, that's what I need.
Mhm. So I'll wait now. Any moment they should get changed.
Okay.
And
Yes.
you are on the right track.
Thank you.
So Maran, this is the door note. Please get the references ready. Can you hear me?
Yes.
Yeah. Okay. Sure.
Hi, I'm around the pharmacist on duty. How may I help you?
Hi, we have scheduled a meeting today for some more info for our group of patients to know how to calculate percentage risk of pre-diabetes or the type 2 diabetes.
Sure, I can help you with that.
Mhm.
How may I address you?
Mark?
Okay.
For me, John.
John. So John, you're the social worker?
Yeah,
Yes, and I see you have here consent from Mark
yeah,
patient to gather information and calculate his risk for diabetes.
yes.
So I'm just gonna need a few information about John to proceed, about Mark to proceed.
Yeah,
that
you
okay?
can go ahead. Yeah,
Okay. So he is 42 years old, is that correct?
yes,
Okay. And here's we have his weight here, 80 kilograms, and his height, 5 feet 9 inches. Is that
yes,
correct?
yes.
Okay. So I'm just going to calculate his BMI for that. Can you give me a few minutes while I do that?
Mhm.
Okay. So, John, can you tell me if Mark has any medical conditions? Okay.
No medical condition.
Is he using any prescription medications?
No prescription medications.
Non-prescription like Tylenol, Advil, multivitamins, or herbals?
No,
Okay. And do you have information about his caffeine intake?
no caffeine intake.
What about alcohol?
Socially.
Okay. And does he smoke?
No.
Okay. And what about his exercise? I see here it says 40 minutes daily. Is this
Yes.
correct? Okay. And his diet, it says that he has
Healthy.
vegetables and fruits 2 weeks, 2 times.
Yeah, yeah. 2 times per week.
Okay. Just give me a few minutes. And he's never had any problem with his blood sugar before, right?
Yeah. There is no problem with any of her medical conditions. He's perfectly fine.
Does he have any relatives that have diabetes?
Mother, type 2.
Okay. And what about his ethnicity?
Pardon?
It says here that he's Chinese, is that correct?
Yes.
Is it both his mother and father that are Chinese?
No, only her mother has the problem.
No, I'm talking about the ethnicity. Both parents are Chinese?
I don't know.
Okay. What about his education? I see here that it said
Bachelor of Law.
bachelor's of law. That's correct. Okay, John, thank you for waiting. So according to the reference I had, which the Canadian Diabetes Risk Questionnaire, I calculated his risk to be 24, which is considered a moderate risk for diabetes.
Okay.
Okay, so would you like to discuss what this means or?
Yeah, you can let me know definitely.
Okay, so this is just a risk calculation. It's not a diagnosis for diabetes or anything, but it's a moderate risk. So we should basically be aware and try to prevent him from developing diabetes. Okay, so he's already exercising, which is excellent. He should keep it up. He may consider increasing his vegetables and fruits intake. He doesn't really have any medical conditions, which are good. He should consider just maybe, I know you said his diet is fine, but decrease his sugar intake just because he's at risk, and follow up with his doctor appointments.
Okay.
And since he's above 40 years old now, he can he'll get tested frequently to check his blood sugar, his lipid levels, and his blood pressure. Other than that, there's nothing to do at the moment.
Right.
Anything else I can help you with?
No, that's good.
Okay, and John, if you would like, I can prepare a small presentation about diabetes risk and present it to your coworkers.
Sounds nice. You can do that. It will be great help for me.
Okay, and if you have any questions at any time, feel free to contact me.
For sure.
Okay, thank you, John, and have a good day.
Thanks, Mariam. Okay, bye.
Mayum, you did really well. Your performance and communication, everything was really good. And I think you were on the right track, but you calculated it 20, you said it's 24 racks,
Yes.
right? Yeah, it was 28. I think you did some mistake while calculating the score. So here my suggestion is, are you recording it? Otherwise you can take a picture of this patient record so you can calculate it later on again. So as a suggestion in this scenario, like if you will be like more interactive while calculating, let me show it to you. So while calculating the scores, if you will be more interactive, let's calculate it together. So for the age group, we will put 0 points. For the gender, we will put this much points. For ethnicity, this much points. So if you will keep saying this, then the examiner will have a fair idea, because there were a lot of things to be marked. Then they will mark all of them. And then I think there will be just one thing that was left. Maybe
I
had the 4 points.
In the paper when it printed, this one wasn't there. The waist circumference.
Yeah,
that's
that
why.
might be a problem. Yeah, that's why it has 4 points. So it will be 28 altogether.
Yeah.
So, if I knew that how you calculated, then like if you will be while calculating, if you will be saying like that for the BMI he will get this much points, for ethnicity this much, then I will have a fair idea like you are calculating in a right way. So it's just a suggestion. Like you will be more interactive and there won't be any like quiet pauses in there, and they will have a fair idea like how you are calculating. So other than that, your performance was really good. So just one thing that you can add, it's good that you offered to do the presentation. So one thing is that you can also offer them that I can give you a printouts of this questionnaire, so you can use it for your further, for your future use. And what else was there? in the starting, you can, because from the door note, you already knew that there is a social worker to be going to be inside the station. So you can have a fair idea in your mind, like how to greet him. Like you can add some sentences like, thank you for providing me the opportunity to assist you. Or you can say that as he was a social worker, so you can say that we always appreciate your work because you're working for a good cause, or this is a health promotion campaign that you're running. So in this way, you can like appreciate him. Other than that, your performance was really well. And but it's good that you calculated the score, which was still in the same range. It was like moderate risk. If you calculated it totally in a different range, because, okay, let me show you from.
Yeah, it was just this one.
Yeah, it's the same range. Yeah, it's still the moderate risk. That's why, like, I can't say that this station is not solved. So yeah, I can say like it's marginally solved because it's still the same range. So, but if you had like while calculating, if you have told the points, like how many points did you put for each one, then it was more better. So, and some of the, like, just a general suggestion, some of the students were not able to calculate it in time. So in that case, it's also help if the examiner is knowing that how much you have calculated up till now. So
Okay.
okay, good luck.
Thank you.
So
Hello, so you have 20 seconds to read the case and then we'll begin.
Hi, I'm Madame the pharmacist on duty. How may I help you?
Hi, I really need Advil for my headache.
Sure, I can help you with that. Please have a seat in our private counseling area. Anything we discuss will be kept confidential, and feel free to ask me any questions at any time. How may I address you?
My name is Jenny.
Jenny. So Jenny, tell me more about your headache.
Sure. So it's been kind of gradual throughout the day. I feel like it's just kind of getting worse, but it feels like there's like a band just squeezing my head from all directions.
I'm sorry to hear that, Jenny. It must be quite troublesome for you.
Mm-hmm.
So Jenny, when did this start?
I started this morning.
Okay, and have you tried anything for it?
No, not yet. I had a similar headache about 6 months ago, so I tried Advil then. So I was wondering if I could use it now as well.
Okay, I just need to ask you a few more questions before I give you, so I can give you my best recommendation. Is that okay?
Sure.
So Jenny, do you feel like anything brought it on?
It might just be stress. There's just a lot on my plate right now.
Okay, I'm sorry to hear that. And do you feel like anything relieves it? I know you said previously you tried Advil. Anything else?
Yeah, I haven't tried anything yet, but that usually does help.
Okay. And have you spoken to the doctor regarding this?
No, not yet.
Okay. Okay, Jenny. So you said you had a similar headache 6 months ago, right?
Yeah.
Would you say this is your worst headache ever?
No, I'd say it's about a 4 out of 10 on the pain scale.
Okay. And you said it came
It's
on
not that
gradually, not suddenly, right?
Yeah.
Okay. And do you have any changes in your vision or your mental status or so? Do you feel a bit confused or anything?
No, nothing like that.
Okay.
Nope.
No fever?
Nope.
Okay. Do you have any one-sided weakness?
No, it's kind of all over.
Okay. Okay. And it's all over your head, right? Not on one side.
Yeah.
Okay. So Jenny, do you have any medical conditions?
I do have depression, but other than that, nothing.
Okay. So I see here that you're using sertraline. Are you using it as prescribed?
Yes, so I'm taking one once a day.
And how are you doing?
I'm doing better. My appetite's coming back, and I feel like my energy is returning too.
That's good to hear. That's great. And do you have any allergies? Any update from that?
No changes to that.
Okay. And other than the sertraline, are you using any other prescription medications?
No, nothing else.
Any non-prescription or multivitamins or herbals?
Nope.
Okay. And Jenny, regarding your lifestyle, sometimes it can affect the way medications work in our conditions. Can you tell me about your caffeine intake, if any?
I don't have any caffeine.
What about alcohol?
Nope.
Okay. And do you smoke?
No, I don't.
Okay. Do you find time to exercise?
Because my energy is coming back, I'm starting to go back to the gym now.
Okay, that's great. And what about your diet?
It's pretty healthy.
That's good to hear. Jenny, keep it up. So Jenny, one last thing, some medications are not indicated in pregnancy and breastfeeding. So I need to ask if you're pregnant or breastfeeding.
No, I'm not.
Okay. Jenny, please excuse me. I'm just going to see the products I have and get back to you. Okay, Jenny, thank you for waiting. So I would actually want to recommend you Tylenol instead of Advil because the medication you're taking, the sertraline and the Advil, they can both increase your risk of bleeding. It's something rare, but we want to avoid it. Okay, so I want to go with the safer choice for you, which would be the Tylenol. Is that okay?
Sure.
Okay, so I'm gonna give you Tylenol extra strength, which is contains acetaminophen, 500 milligrams. You can take 1 to 2 tablets every 4 to 6 hours, maximum of 8 tablets a day. Okay, and you should start feeling a relief shortly within 15 to 30 minutes. And is this the first time you're using it?
Yes, it's the first time.
Okay, so if you experience any shortness of breath, hives all over your body, or swelling in your mouth or tongue, you need to stop it and contact 911 immediately. Okay, and usually it's well tolerable. If you happen to experience any abdominal stomach upset, you can just take it after food. Okay, and for your headache, you can use some ice packs. It can help relieve it. You can sit in a dark, quiet room. That can also help with it. And I know you said it's stress that might have brought it on. So just try to engage in any exercises that will decrease your stress level. And just monitor, keep a diary or a logbook of your headaches. And if you find that you're using the Tylenol for more than 15 days a month, you're going to need to see the doctor for that. Okay. Because if you use too much medications, that can be a reason to get a headache once more. Okay.
Okay.
Anything else I can help you with, Jenny?
No, it seems like you've answered everything.
Okay, and if it's okay with you, I would like to give you a call in a few days to follow up and see how you're doing. Is that okay?
Sure, that would be great.
Okay, Jenny, if you have any questions, feel free to call us at any time, and I hope you feel better soon.
Okay, thank you so much.
Thank
Have a
you.
good day.
You too.
Okay, ma'am. So how did you find that case? Is it easy?
Should be.
Yeah, you did really well, actually. So yeah, the main issue that we were trying to tackle here was the interaction between the sertraline and the Advil. So you mentioned that there is an increased risk of GI bleeding, which is correct, and the proper recommendation would be Tylenol. You explained how to take it, and you explained the onset is fairly quick, and you went over the fact that if it's the first time she's taking it, just watch for any anaphylactic reactions. The one thing that you could have added to make it a 10 out of 10 case would be medication overuse headaches. So if you're seeing yourself using the Tylenol for more than 15 days,
I said
just be
that.
wary. Did you say that?
Yeah.
Okay, probably didn't hear that then. Other than that, then you got everything then.
Yeah. I said if you
So
use it for more than 15 days a month, you need to see the doctor.
okay, that's fine then. Other than that, yeah, you did very well. Any questions for me?
No. Thank
Okay,
you.
perfect.
Hi, Maram.
How are you?
How was it?
It was good. I did really well in the first case. I don't know. I wasn't focusing.
Yeah, the first case is very crucial. I saw that.
I need very
Generally, you get 10 out of 10, but it was 7. It's okay. And the dispense checking number 1.
Okay, so medication, this one, yeah. Medication on label should be Marvelon 28. Medication dispense should be Marvelon 28.
Good. And the repeat. The repeat should be 12, right?
Oh, wait, let me see the
Yes.
repeat for the first one. Okay. Second one, doctor's name on label should be Dr. Song, SONGM. Quantity on label should be 15 ml.
Good job.
Third, repeat on label should be 0.
Mm-hmm.
Or doctor name on label should be Dr. Price, PRICAA, and repeat should be 1. And 5, no corrections.
Wonderful.
First one, I just wrote inappropriate direction.
So you just write down maximum dose. Which is a dose.
So I write inappropriate direction, maximum dose exceeded.
Yes, just write down, the dose per day exceeds the 4 gram or daily dose.
Okay. And then second one, date is not indicated.
Wonderful.
Third, patient ID is not indicated. Doctor license number not indicated.
Mm-hmm.
4, prescription time lapse, medication not useful after 72 hours.
Wonderful.
5, medication out of scope of ophthalmologist.
Good job. Full mark. Number 3.
Okay, first one, consider further therapy.
Mm-hmm.
Second, 4 to 8 weeks.
Mm-hmm.
Third, 50% within 7 to 10 days.
Mm-hmm.
2 to 3 weeks. And then 80% within 1 to 2 weeks. Daily, and then 1 to 2 weeks. Okay.
Good job.
Yes, premature closure of doctor's outro uses. Codeine, CNS and respiratory depression in infant. Saline nasal oxymetazoline, xylometazoline, phenylephrine, 3 to 5 days. It's decreased, the milk. And then check for thrush, GI symptoms, diarrhea and rash.
Mm-hmm.
And then maintain blood theophylline level in the low end of therapeutic range for the mother. And yes.
Good job. There was a case, mom is coming with diarrhea for the infants. And the main question we forget to ask, breastfeeding, if yes, then did you have antibiotic? Yes. Then you give a reason and then Pedialyte. That's why I put it here so that it registers.
Okay.
Okay, so RS screening.
First, date not indicated.
Mm-hmm.
Second, patient ID not indicated, and doctor license number
Mm-hmm.
not indicated. Third was fine, no
Uh-huh.
problem. 4, inappropriate route of administration.
Mm-hmm.
5, prescription time lapse.
Or for antibiotic, old prescription cannot be filled.
Okay.
Okay, good job. So keep it up. Your first now case will be number 1. Okay.
Okay.
I'm leaving this room and just relax for a few minutes. Don't try to remember. Don't see your assessment now. Okay.
Okay. Hi, I'm Maram, the pharmacist on duty. How may I help you?
Hi there, my name is Jill and I'm here to pick up a prescription, please.
Sure, I can help you with that. Please have a seat in our private counseling area. Anything we discuss will be kept confidential, and feel free to ask me any questions at any time. So Jill, may I ask the prescription you're here for?
Yeah, it's for my UTI.
Okay. And how are you feeling?
I'm feeling okay, just in a little bit of pain.
Okay, I'm sorry to hear that, and hopefully this medication will help you. So Jill, before moving forward, I need to assess the appropriateness of the prescription. I need to ask a few questions. Is that okay?
Yeah, that's fine.
Okay. So Jill, other than the UTI, do you have any medical conditions?
No,
Okay, and I see here on your profile that you don't have any allergies, any updates?
no allergies up to now.
And are you using any prescription medications at the moment?
It should be on my file.
Yes. So I see here you have the seasonal, the contraceptive.
Yeah.
Are you using that?
Yes.
Okay, so we can rule out any chance of pregnancy?
Mhm.
Okay, and breastfeeding as well?
Yes.
Okay. I only ask because some medications are not indicated in pregnancy or breastfeeding.
Yeah, that's fine.
And are you using any non-prescription medications like Tylenol, Advil, any multivitamins or herbals?
Nothing.
And Jill, sometimes our lifestyle can affect the way medications work in our condition.
Sorry?
Sometimes our lifestyle can affect our medical conditions and the way medications work. So can you tell me about your caffeine intake, if any?
I don't drink any coffee or anything.
What about alcohol?
No.
And do you smoke?
No.
Okay. Do you find time to exercise?
Yes.
That's great. And how would you describe your diet?
Healthy.
Okay, that's great. So Jill, can you please excuse me for a few minutes while I'll check on your medication? I'll come back.
Yeah, sure, no problem.
Thank you. Okay, Jill, thank you for waiting. So Jill, your doctor has prescribed you Manurol, which contains phosphomycin. It comes in 3 grams, the concentration, the strength of it. Okay. And so this comes in a sachet form. You're going to add it to about 125 mils of cold water, stir it to dissolve, and immediately take it. Okay. And it's best if you take it on an empty stomach or at least 2 to 3 hours after a meal because food can delay the absorption of the medication.
Okay.
Okay. And although this medication, apart from the beneficial side effects, you may experience or may not experience some side effects from the medication, such as some nausea, headache, diarrhea, some dizziness. So avoid operating any heavy machinery or driving after using the medication. Okay. And this is the first time you're going to be using it, right?
That's right.
Okay. So if you experience any rash all over your body, hives, difficulty breathing or swelling of mouth and tongue, you need to contact 911 immediately. Okay. And so this is only one dose for the medication for your UTI, and it should start working within a few hours after you take it. Okay. But it might be a few days until you feel a complete relief of your symptoms and the pain. And if the pain is bothering you, I can recommend some Tylenol for you.
Okay, sure.
Okay. Do you have some, or do you want me to give you some?
No, that's okay. I have some, so I'll just use the same supply. I actually had a question for you. Are there any interactions with seasoning and this medication?
Okay. Just give me a second. I'm gonna just check that for you. I'm gonna double
Sure.
check.
No problem.
Two minutes remaining.
Okay. So Jill, the reference, which is the fosfomycin monograph, doesn't state an interaction with your contraceptive. But if you do experience diarrhea, that may decrease the effectiveness of your contraception, and you can just use backup for the day or for, you know, how long the diarrhea lasts.
Sure, no problem. Okay, thank you so much.
Okay. Anything else I can help you with?
I guess that's it.
Okay, and Joel, just some self-care measures for your UTI. Just stay hydrated, increase your fluid intake. Make sure you wear cotton undergarments when using the washroom. Wipe from front to back to avoid any bacteria spreading from your rectum area to the front area. And if it's okay with you, I would like to give you a call in a few days to follow up and check how you're doing.
Sure, no problem. Thank you.
Okay, thank you, and I hope you feel better soon.
Thank you.
Mara?
Yes.
Hello, hi.
Hi.
Excellent job. You did great. In terms of your communication, you're very clear, very confident, very professional. The way you gathered the information, it was very organized, you know, with the questioning, and everything you asked, you explained to the patient why, for example, in terms of pregnancy, breastfeeding, lifestyle. So that was great. The only thing in terms of communication that I wanted to mention was a bit of a disconnect. You know, I felt like you can be a bit more friendly with the patient to
Mhm.
have that kind of relationship. I don't know if it's just, you know, the basically, you know, us being on the monitor and all that, but see, look at that
Today.
smile.
It's
You
just
know,
today.
yeah, so you know, I love that smile. Use it, please, you know, when you're talking, not just for the Oskies in general, you know, it goes a long way when it comes to our relationships with our patients. Just, you know, smile you because you're so great. The whole time you were just like, I saw a wall here. Like I couldn't see the connection to the patient, even though you were doing everything perfectly. It was just like something was missing there. I think a smile, just, you know, the things that you're explaining, just be a bit more friendly because you are so great. You're almost perfect. I didn't have any comments. That was just the only thing, you know, I wanted to mention to make it even better for you, because even, you know, I can see you as a pharmacist, and when you're working, you know, in a pharmacy or elsewhere, the relationship that you want to develop with your patients, basically, it is based on that. It's based on how you connect with them and how you talk with them. Um, Overall, in terms of the content, you covered everything. I'm not sure if you mentioned that, for example, if she doesn't see any improvements in her symptoms. So always just let them know, especially when it comes with infections, to infections. You know, if they don't have any improvements in symptoms, for example, in 3 days or so, to contact their doctor. That's just looking, you know, ahead, basically. I know you mentioned the medication will take effect in a few hours, but also it's important to them to know that it will not go away right away. So it may take some time, which you mentioned. That was good. overall, great job, Mara. I think you're good. Yeah, just use that. See, I like that so much better.
I usually do, but today's just
Yeah,
not the
it's
day.
not your day. That's fine. That's fine. I know sometimes it's just and it's a Sunday, so I'm sure you do better. You're great. Keep up the good work and best of luck.
Thank you.
Because some people, even if are talking the, oh, she's here.
Hi, I'm on the pharmacist on duty. How may I help you?
Hi, pharmacist. Can I get emergency contraceptive pill, please?
Sure, I can help you with that. Please have a seat in our private counseling area. Anything we discuss will be kept confidential, and feel free to ask me any questions at any time. So how may I address you?
My name is Susan Brooke.
Okay, and Susan, you're a regular patient of ours?
Yes.
Okay. So you're asking for emergency contraceptive?
Yes.
Okay. Can you tell me what happened?
I normally take the Microno at 7 p.m., but unfortunately yesterday I missed it. I took it at 11 p.m. So I'm really apprehensive about getting pregnant.
Okay. I can see how that must be worrying for you.
Thank you.
Sorry, Suzanne, I'll try my best to help you. So Suzanne, you just missed your pills by 4 hours last night?
Yes.
Okay. And did any intercourse take place last night?
Yes.
Okay. And can you tell me what week are you on?
Second week.
Second week. Okay. Okay, Suzanne, before going forward, I just need to ask you a few questions. Is that okay?
Sure.
Okay. So Suzanne, do you have any medical conditions?
No.
Okay. It says here no allergies. Any updates?
No allergies.
Okay. And are you using any prescription medications other than the Micronor?
No, just Microno.
Okay. Any non-prescriptions like Tylenol, Advil, multivitamins, or herbals?
Nothing.
Okay. And sometimes our lifestyle can affect the way medications work in our conditions.
Okay.
Can you please tell me about your caffeine intake, if any?
I don't take any.
Okay. What about alcohol?
Nothing.
Okay. And do you smoke?
No, I don't.
Okay. Do you find time to exercise?
45 minutes walk every day.
That's great. And how would you describe your diet?
Healthy.
Very good, Suzanne. Keep it up, please. So Suzanne, I see here that you were switched from the Alice to the Micronor because you were breastfeeding. Are
Yes,
you
I
still
was.
breastfeeding?
I stopped a month ago.
Okay, okay. Okay, Suzanne, I just need to ask about your weight. If
Sure.
that's okay, because the emergency
problem.
contraceptive is just, it has like a weight limit, yes.
Sure, it's 70 kg.
70 kilograms, okay. And have you used it before?
Which one, Plan B?
Yes, the Plan B?
No.
And this is the one that you're asking for, correct?
Yes, please. Or any other suggestions you might have, I'm open to them.
Okay. Suzanne, I'm just gonna go check over my references and come back to you, okay?
Thank you.
Thank you. Okay, Suzanne, thank you for waiting.
Thank you.
So Suzanne, first I just need to begin with saying you're gonna need to use backup for the next 2 days after missing
Okay.
your pill. Even though you're gonna be using the emergency contraceptive, but you can still, use backup if it'll make you feel more comfortable or not. Although it's not necessary after using the Plan B. Okay, so I can recommend the Plan B for you since it's only been within the time frame. So Plan B contains levonorgestrel, which is a progestin. It comes as 2 pills. You're going to take 2 of them at the same time, 1.5 milligrams.
Okay.
Now, it's important to know that this medication can cause some nausea and vomiting, so it's recommended to use some Gravol 30 minutes before the medication. Okay, and I can give you that as well. And if you do experience vomiting within 2 hours, you're going to have to take a replacement dose for it.
Okay.
Okay, and so that's about the medication. Your Plan B. So yes, you may experience the nausea, vomiting, some abdominal cramps. Now, since you're taking this as the first time, if you experience any shortness of breath, hives all over your body, you need to contact 911 immediately. And you need to keep an eye out for your menstrual cycle. If it's late for more than a week, you need to contact the doctor to rule out the possibility of pregnancy.
Okay.
And Suzanne, just please remember that contraceptives don't protect from sexually transmitted infections, and keep up safe sex practices like using a condom that will protect you. And if this is something that would happen in the future more often, missing your pills, you can talk to the doctor about other contraceptive methods that are more reliable and ones that you don't have to take so frequently.
Okay. Can I continue taking the Micronol with the Plan B?
Yes, that's fine. There's nothing wrong with that. So you can just so you can take the Plan B today, and you can take your contraceptive tomorrow.
Okay.
Okay.
Sure.
Anything else I can help you with?
No, you've been great. Thank you so much.
Okay, Suzanne, if it's okay with you, I'd like to give you a call in a day or two just to follow up and see how you're doing.
Thank you so much.
Okay, thank you. Have a good day.
All right, Mom. How do you feel?
Like I was running out of time.
No, but you did really well. Like good information gathering. You asked about the weight. You asked about everything. Really good. Even you were clear, confident, organized. Good information providing. You didn't miss a point. Just one thing. When you told her that a backup method won't be necessary after you get the Plan B, no, it's still necessary. So Plan B is like to prevent pregnancy from the intercourse that she already have. But if she's gonna have any other incidents or any other relationship within the next 48 hours, she's still gonna need a backup method.
Okay.
Right? This is the only point that I want to add here. Other than this, like spot on, you got everything.
Yeah.
And just to confirm, she can go back to taking the contraceptive next day?
Yeah. She already took the missed pill
Yeah.
yesterday, and yeah, she can take today's pill. That's fine.
Okay. That's with the Ulipristal, where they have to hold off the progestin contraceptive, right?
Yeah. But
Okay.
this one, no, it's fine. It's not necessary. They can still like Plan B is okay with all the birth control, other birth control medications, so it's fine.
Okay.
That you felt it's very long?
A bit long, and then the second page where it had the fentanyl one, it was really blurry, basically all of it. So I went and I opened the soft copy.
Oh, that's why. And I thought like, where are you? Like you're looking at the screen.
Yeah. So this is the second time this happens to me today. In the other case, it was printed and basically one piece of very important information was missing when it was printed, and it's just messed up everything.
That's unfortunate, but it's okay. Like, I mean, it's okay because you never know in real exam. I'm gonna go back to the first slide before someone comes. Okay, in real exam, something might happen. So
Yeah.
this gives you kind of a practice on how to deal with stress. I was worried that something is happening to you because I wasn't aware that you're looking into a screen or something.
Yeah, it's just the printing error, I guess, today.
Yeah, that's okay. That's okay. But well done. Like, don't worry. These are small things. Hopefully, this will never happen in the exam because you will have
Yeah.
everything properly in front of
Proper.
you.
Yeah.
You will be able to communicate better and just be confident and strong and speak up, you know?
Mhm.
Long cases, HCP in front of you, nurse, doctor, physician, student, whatever. You read the reference right away from the beginning. It might be a caseworker coming to ask you how to use the naloxone kit. I had this case in my OSCE. I saw that the reference was like 4 pages. I said, since you're a caseworker, like, what is your background? She said, I have a medical background. I said, okay, so let's read it together. Are you okay with that?
Yeah.
So Marvin, this is the door note. Please get the references ready.
Hi, I'm the pharmacist on duty.
Yeah, hi, I'm John. I have an appointment today. And what is so important about this session?
Thank you, Robert, for coming. I appreciate you taking the time. So just so you know, this is a private counseling area. Anything we discuss will be kept confidential, and feel free to ask me any questions at any time.
Okay.
So Robert, the reason we called you in is because you've been using the painkillers for quite some time now.
Okay.
Almost a year now. That's correct?
No. It was 6 months.
Yes, and 2 months, so about 8 months now.
No, last total exactly 6 months.
Okay, and you're using the Percocet 5325, correct?
I'm using Percocet only as when needed, not around regular basis. And trust me, I'm not abusing it.
Yes, I'm not insinuating that you're abusing it at all.
And secondly, I'm not experiencing any side effects. And that's it.
So can I ask, how is your pain?
Right now it's good, but sometimes it turns really bad. That's where the Percocet role comes.
Okay, I'm sorry to hear that. But it's generally well controlled on the Percocet?
Yeah, it's really a good medication.
Okay. So Robert, the reason we called you in is because the Percocet that you're taking, it contains opioids, and I'm not sure if you're familiar with this or not, but opioids, even if you're not taking them like regularly, they can pose a risk to your health. They can cause an overdose. Again, I'm not saying that you're abusing it, or that you're dependent on it, but we just like to be careful, and we like to get ahead of things should they get ugly in the future.
Okay.
So I just have a few things that I wrote down here. I'm just going to go over quickly. Okay.
Sure.
And then I'll get back to you. Okay, thank you, Robert. So Robert, as I was saying, the use of opioids, sometimes it can lead to an overdose. It may not be anticipated, and you may experience something like, as far as you can be unconscious, you can have shallow breathing, you can have pinpoint pupils, and that can be very dangerous and even fatal at some times. So what we do is that we recommend that you have something called Narcan, which is naloxone. It
Okay.
will basically reverse the effect of these opioids and prevent death.
Okay.
Okay, so I would like to offer you one today, and I would like to talk to you about how to use it.
Okay.
Okay, so here we have an Arcan product, and I'm
Okay.
going to give you a printout of this so you can go over it at your own time, at your
Okay.
own. Okay, so this is a spray, and it's a good idea that those around you, your direct contacts, if you're comfortable with it, they're familiar with how to use it in case you're unconscious and you can't use it yourself. Okay.
Okay.
So basically, this is a nasal spray. What happens when a person is experiencing an overdose is that you check if they're conscious or not. You try to shake them. You ask them if they're okay. A person is laid down on their back to receive the spray. So for the spray, you will remove it from the box. You will hold it with your thumb on the bottom and the plunger or the nozzle between your index and your middle finger. And you will gently put the tip of the nozzle into either nostril. Okay. The head should be tilted back with support under the neck. Okay.
Okay.
Gently, you will insert the nozzle and press it. Press the plunger firmly. Okay. Those will go in. And you need to contact 911 immediately. Okay. And if a person is not conscious after the first spray, they can take another dose every 2 to 3 minutes if you have another spray available.
Sounds good. Okay, thank you.
So this is about the spray, and we went over the signs if you are going to be experiencing an overdose. If you are conscious, you would need to call 911. And if not, someone around you would call 911. Okay. Another thing I would also like to mention is that the medication itself, if it's combined with the other opioids or alcohol, it can also cause this effect on your respiratory system, like it will affect your breathing and it may be fatal. So it's important to avoid any alcohol or any illicit drug use with the Percocet. Okay.
Okay.
Anything else I can help you with?
No.
Okay. Robert, as I mentioned, I'm going to give you a printout of all this information to keep it with you. I am giving you the Narcan kit
Okay.
with you. And if you have any questions, you can call us at any time.
Okay.
Okay. And I thank you again, Robert, for taking the time to come in and discuss this with us.
Okay, thank you.
Thank you very much.
You did really well, and you covered almost each and every point, and still 1 minute is left. So you can use this time, even if in the exam, if you get some extra time, you can still use it, and you can say, okay, let me see if I can give you some extra information. And then you can go to the reference again, and then you can find if you can give him some extra information. So you covered almost each and every point. Just I think just a single thing is left, which was the expiry date, because he's not going to use it right away. So he should be aware of that. If this medication gets expired, he need to bring it back to the pharmacy, and then you can offer him a new one. So this is the thing that he should know, that this has an expiry date. So what else is there? Always remember, when there is a reference and there is some demonstration from the pictures, it's always a good idea to show them the pictures. So it increases the understanding, and also it saves your time. That you can show the pictures, and then so like you can say that, okay, we can study it together. So it's always a good idea. And other than that, in the starting, you did really well. You welcomed him, and you offered privacy and everything. What else was there? Other than that, you covered each and every point. Just the expiry date was left, which I told you. Okay. Any other question?
No, thank you.
Yeah, it was a simple station, just counseling about Narcan. So also you can add like because he's, as you know, that he's, and you also acknowledge that yeah, I know that you are using it on PRN basis, the Percocet. You can also add on that maybe you won't need it for yourself, but as this medication, this Percocet is going to be in your home, so maybe some children or anyone else ingest it accidentally. So it's always a good idea to have it in your home.
Okay. Thank you for that.
Yeah, you're welcome.
So we'll begin in like 20 seconds. Just know that there's no drug-related problem in this case.
Okay. Hi, I'm Madame the pharmacist on duty. How may I help you?
Hi, I'm here to pick up my new prescription.
Sure, I can help you with that. Please have a seat in our private counseling area. Anything we discuss will be kept confidential, and feel free to ask me any questions at any time. May I have your name, please?
Sure, my name's Lily.
Okay. And Lily, you're here for a Camprosate, the Campral prescription?
Yes.
Okay. May I ask the reason why you visited the doctor?
Yeah, so I've been trying to quit drinking, and so my doctor said this would help me.
Okay, Lily. First, I want to congratulate you on that decision and taking that step. That's really good to hear, and we're always here to support you and help you in any way that you need. Okay. Okay, Lily, just to assess the appropriateness of the prescription, I need to ask you a few questions. Is that okay?
Sure.
Okay. So Lily, do you have any medical conditions?
No, I do not.
Okay. And I see here on your profile that you don't have any allergies, any updates?
No changes.
Okay. And are you using any prescription medications at the time?
Right now, no. I was given diazepam 10 days ago to help with the withdrawal symptoms,
Yeah.
but I finished that a couple days ago, and now I don't have any withdrawal symptoms.
Okay. I'm glad to hear you're feeling much better. And Lily, are you using any non-prescription like Tylenol, Advil, multivitamins, or herbals?
No, nothing like that.
Okay. And sometimes your lifestyle can affect the way medications work in our conditions. So can you please tell me about your caffeine intake, if any?
No, I don't have any caffeine.
Okay. And do you smoke?
Nope.
Okay. And do you find time to exercise?
About 30 minutes 5 times a week. I like to go for walks.
3 minutes? 30 minutes?
For 30 minutes, 5 times a week.
Okay, that's great. And how would you describe your diet?
Pretty healthy.
That's good to hear. Keep it up. And Lily, some medications are not indicated in pregnancy and breastfeeding. So I need to ask if you're pregnant or breastfeeding.
No, I'm not.
Okay. Okay, Lily, please excuse me for a few minutes while I'll check on your medication and I'll be back, okay?
Sure.
Okay, Lily, thank you for waiting. So Lily, your doctor has prescribed you Camphral, which contains acamprosate 333 milligrams. He wants you to take 2 tablets 3 times daily, so approximately every 8 hours. Okay, and you can take it with or without food. It doesn't matter, but it can cause some stomach upset, like diarrhea or nausea. So you can take it after food. Okay, and along with the beneficial effects of the medication, you may or may not experience some side effects. As I mentioned, the stomach upset is quite common, and you should just continue taking it. If it's bothersome, then only you need to talk to your doctor, okay? And given this is the first time you're using this medication, if you experience any shortness of breath, rash all over your body, or swelling of mouth and tongue, you need to stop it and contact 911 immediately, okay? And it's important that if you forget a dose or you miss it, just skip it and resume your normal schedule of taking the dose, okay? Another important thing I want to mention is that if you experience any changes in your mental thoughts or thoughts of self-harm, this is serious and you need to contact your doctor right away or as soon as possible, okay? And it's important that you also engage in counseling along with using the medication. They go alongside, okay? So the medication on its own, it's just gonna be more beneficial if you adhere to the counseling,
Sure.
okay? Have you started on that or do you have any plans for that?
Sorry, yes, I've spoken to my doctor about that.
Okay.
But I have a question.
Yes, please.
I heard that, like, I know alcohol is bad for the body, but what exactly does it do? Like, what harm does it cause?
So alcohol can cause a lot of harm to your body. The simplest I can say is it can, if you continue taking it for a very long time and in large amounts, it can harm your liver. And damage to the liver is very serious. It can harm like many other organs and affect your body. Basically in the ways that we don't want. We want to avoid it. Okay. And it can also cause like consumption of alcohol. It can also cause you to like, it decreases your breathing. Sometimes it can be fatal. All things that we want to avoid. I can also share with you information printed out about the harms of alcohol use, if you would like.
Yeah, that would be great.
And Lily, if it's okay, we'd like to give you a call in a few days just to follow up and see how you're doing with the medication.
Sure, yeah.
And just, I would just want to recommend that you keep yourself engaged and avoid anything that would remind you of your drinking habits or situations where you find yourself that you want to drink. And if you have any questions at any time, you can give us a call. We're always here to help you.
All right, thank you so much.
Thank you and have a good day.
Thank you.
Okay, Maram, how did you find the case?
Interesting. I've never
Yeah.
we never came across the acamprosate before.
Yeah, it's mostly used in alcohol dependency, but it's not used that, like, I don't see it that often either. But it's a good case. It gives you a lot of exposure into, like, substance use disorders. In this case is alcohol dependency. But yeah, you did very well. The case is pretty straightforward. It's just mostly just education and, like, straight up counseling on how to take the medication. So you did good, and you did acknowledge at the beginning that, she's trying to quit drinking alcohol, and the last drink was 10 days ago. And you gave good instruction on how to take the medication. So 2 tabs 3 times a day, with or without food. And you mentioned the side effects. So if you experience any abdominal pain, you can take it with food. Another thing you also mentioned, I didn't dock marks or anything for this, so it's just like a side note. Don't crush, split, or chew the tablet. It is quite important sometimes, especially when with coated tablets like a compressate. So it's good that you mentioned that. And the onset of action for the medication, right? So we want to make sure the patient knows that it's not the quickest onset, because we don't want them to take the first dose and then feel discouraged, thinking that it's not working, right? So we got to tell them it takes a few days for it to kick in, but don't feel discouraged if you still have cravings right off the bat. Just abstain from alcohol, right? But yeah, you mentioned the liver toxicity and respiratory effects of long-term alcohol use. Some other effects are also like changes in heart rate and blood pressure, but you still ended up answering the question, so that's good. Overall, you did very well. You got 9.5 out of 10 for the outcome, and you got 4 out of 4 for communication and performance. So any questions for me?
No, not that I can think of. Thank you.
Yeah, no worries. It's fairly straightforward, but yeah.
How's it going so far?
It's okay.
Good. So let's do some online dispense checking. Go ahead.
Okay, direction on label should be take 1 tablet by mouth as needed. And repeat on label should be 3.
Good job.
No problem, dispense.
Good job.
Patient's name on prescription, on label, sorry, should be Sonia. Right, well.
Wonderful. So you write down full name, okay?
Yes. No problem, dispense.
What did you see the product dispense?
Pantoprazole, magnesium. Okay. Medication dispense should be pantoprazole sodium.
Yes. So, and then if you want to know, Pentaloc is a brand name for sodium, and Tecti is a brand name for. That's why you see T here. That's why it is T there, just for your information. No need of knowing, but yeah, just see the salt also. Sometimes it is different, right? Okay, so this is a blister check. You just tell me where you fill the bubble. No need of telling missing an error because you're not writing, okay?
Okay. Okay, so I can do one at a time, right?
Yeah, you can just tell me.
Okay, so Ramipril.
The drug number 1, yes.
Yes, drug 1, Tuesday, Wednesday, Thursday, no, sorry, Tuesday, Wednesday, and in breakfast, lunch Tuesday, and supper Wednesday.
Good job. So drug 1 is done. Drug 2, amlodipine.
Okay. Drug 2, lunch Tuesday.
Good job.
Supper Tuesday and supper Sunday.
Good job. And drug 3, metoprolol now.
Okay. Breakfast Friday.
Okay.
And supper Sunday.
Good job. And the last one.
That's in drug 4. Bedtime Sunday.
Good job. So you're non-retrieve 100% for all the time. I saw the assessment also. You're good to go. Don't worry about anything, okay? You are excellent. You'll be great. See you in the May as a assessor.
Hopefully, I really hope I can go forward with the exam.
Yeah, that's we'll pray God, I think tomorrow. Once you get, just let me know, okay?
Yes, definitely.
Just for your information, but good luck. Don't stress out too much, just rest. Do whatever I told you in last week, nothing more than that, okay?
Okay.
Thank you and good luck again.
Thank you, sir.
To UTI or other infections, we always have to kind of change what we use in terms of antibiotics. For example, I know right now in Ontario, we're having more resistance to TMX, trimethoprim, when it comes to UTIs. So, it's ever changing, and we have to be very careful about the use of antibiotics and not overuse them, just to avoid basically if patient actually needs it in the future. For example, in this situation, if patient becomes resistance, or resistance becomes something in the area, because you usually check your area to see, for example, in the hospitals, when it comes to antibiotic use, They check resistance in terms of the local resistance and use antibiotics very, very carefully. So we have to be cautious of that. Overall, great job, ma'am. Keep up the good work and
Yeah.
best of luck on the rest of the cases.
Thank you.
So get the fuck.
Hi, I'm Madam, the pharmacist on duty. How may I help you? I can't hear you.
Sorry, I was wondering if I can pick up my sugar pills, please.
Sure, I can help you with that. Please have a seat in our private counseling area. Anything we discuss will be kept confidential, and feel free to ask me any questions you have at any time.
Okay.
May I have your name, please?
My name is Tochi Scott.
Okay. And you're here for your sugar pills, you said?
Yes.
That would be the metformin, 500?
Yes. Yes.
Okay. Tochi, before I go ahead, I just need to confirm the information on your profile and update it if necessary. Is that okay?
Sure.
Okay. So what medical conditions do you have other than the diabetes?
Nothing else.
Okay. And what prescription medications are you using currently?
I'm taking just metformin.
Okay. I see here that you're also prescribed atorvastatin and the pneumococcal vaccine, but you haven't taken them. Is that
No,
correct?
I've not. No.
May I ask the reason?
I feel I don't need the atorvastatin because I don't have any issues with my cholesterol.
Mhm.
And about the pneumovax, I'm a bit wary of vaccines, so I'm not yet in the right frame of mind to take it.
Okay. Tasha, did you discuss these concerns with your doctor?
Not yet. I was planning to discuss it with him next time I see him.
Okay. And when's your next appointment?
Next month.
Okay. So how's your diabetes? How's your blood sugar? Is it
Good.
controlled?
Yes.
Do you have your latest readings?
Yes. I have my fasting is between 5 and 6, and
Mhm.
after food is between 7 and 9.
That's great. Do you have your A1C?
My A1C is 6.9.
Okay. That's great. That's great, Tochi. Thank you for the information. And I see here that you don't have any allergies. Any update there?
I don't have any allergies.
Okay. And are you using any non-prescription medications like Tylenol, Advil,
No.
any multivitamins or herbals?
No.
Okay. And regarding your lifestyle, sometimes it can affect the way medications work in our conditions. So can you please tell me about your caffeine intake, if any?
I don't take any.
What about alcohol?
No alcohol.
Okay. And do you smoke?
No.
Okay. Do you find time to exercise?
Yes, 45 minutes walk every day.
That's great. And how would you describe your diet?
I follow the Canadian Food Guide for diabetes.
That's really good. And Toji, I just some medications are not indicated in pregnancy and breastfeeding, so I need to ask if you're pregnant or breastfeeding.
No, I'm not.
Okay. Thank you for that information. So if you just excuse me for a few minutes, I'm going to check on your medication, and I'll get back to you.
Sure.
Okay, Tachi, thank you for waiting.
Okay.
So I have your metformin refill here. You're taking it regularly as prescribed, correct?
Yeah, 2 tablets, 12 hours every day.
And is everything okay with it? Do you have any
Yes.
concerns with the medication?
No, I don't.
Okay. So I'm giving you your metformin refill, but I want to talk to you about the atorvastatin and the pneumococcal vaccine, if that's okay with you.
Sure.
Okay. So Tasha, I understand that you said your lipid levels are fine and you don't think you need the atorvastatin.
Yeah.
But actually, even if your lipid levels are fine, atorvastatin is given to protect you from any cardiovascular disease, anything happening to your heart. As I'm not sure if you know this or not, but diabetes can affect many organs in the body, one of them being the heart and your blood vessels. Okay.
Okay.
And Diabetes Canada recommends that anyone above the age of 40 use the atorvastatin to protect your heart.
Okay.
Okay. So basically, it's going to protect your heart, protect your blood vessels from any heart attack or so.
Okay.
Okay.
I have a question for you, pharmacist.
Sure.
The last time I saw the doctor, he mentioned A1C. I'm wondering what it means and what it has to do with diabetes, please.
Okay, so A1C is basically a way of monitoring your blood sugar levels. So you have your fasting, your 2 hours after eating, and A1C gives us an idea of your control over the past 3 months of diabetes. Okay, so usually for most people, their target is something the A1C to be below 7.
Okay.
Okay, so this gives us, so your control is good at the moment. You should keep it up. The exercise and the diet, everything is fantastic. How do you feel about starting that atorvastatin?
Well, since it's good for me, I think I'll start it. Thank you so much.
Okay, do you want me to give it to you today?
Sure, if I can.
Okay, I'll do that. And regarding the vaccine, I also want to stress that being a diabetic, you can be more prone to certain illnesses or complications from illnesses. And we highly recommend that you get vaccinated, like with the flu vaccine and the pneumococcal vaccine, just as a way of protection. Okay.
Okay.
So I also highly recommend that you take the vaccine.
Okay.
Okay. How do you feel about that?
I will.
Okay. And Tochi, I just want to remind you that exercise and diet is perfect. So keep up with your doctor appointments, your eye checkups, your regular monitoring of your feet, your annual vaccines like the influenza. Okay. Eye checkups I mentioned for you. I don't think I missed anything for you. Your blood pressure, the doctor will do that at your visits and your blood work. Okay.
Okay.
And do you have any other questions for me?
No.
Okay, so I'm going to dispense your metformin, get your atorvastatin ready, your pneumococcal vaccine.
All right. So Tochi, what do you think?
Good.
Yeah.
She was
So
spot on.
yeah, like there's nothing was missed, to be honest. Like
Yeah.
everything was on point. Like excellent job, good information gathering. There's nothing to add here, and I feel it. You will pass.
If I go to the exam.
Yeah, hopefully you will, and when you go, you will pass.
Definitely. You're so
No,
confident. You ooze confidence, and the patient has this connection with you.
That's thank you for saying that. Like
No,
I
really,
admire you
it's
from
true.
the online videos that we used to watch.
Oh, thank you.
Yeah, you were really great during class.
Thanks. Thank you.
Thank you.
You did an amazing job. Confident, clear, information providing. You take pauses. You're so friendly. You address all the concerns, and even if you don't at the time, you go back to it. It was like, no, it was so good. Like, good job, amazing.
Thank you.
Yeah.
It was a good ending.
Yeah.
So very bad part.
No, just one tip. When you do bad in one station, don't affect the other one.
Yeah.
Forget about it. Try to let it go, okay?
Yeah.
Okay. Okay. Thank you, guys.
You're welcome. And good